of school-aged children are diagnosed with ADHD, attention deficit hyperactivity disorder. Onset occurs by the age of 7. A diagnosis will not be made unless the behavior has been present in the child for 6 months. Most of the time, ADHD is overdiagnosed by many doctors. ADHD is when a child shows inappropriate or excessive inattention, carelessness, and hyperactivity. ADHD is usually recognized in schoolwork by having difficulty paying attention. ADHD is when the hyperactivity and restlessness messes with their ability to function in school. The child can simply not sit still. ADHD has a lot of effect on getting along with others. It also has a lot to do with fidgeting of the hands and feet and squirming in his or her seat. ADHD is when a child has difficulty playing quietly and talks all the time. These children have a habit of switching from activity to activity. ADHD children also have a hard time waiting in line or taking turns while playing games. ADHD tends to run in families for both boys and girls. ADHD is more common in boys than girls, though. Some researchers have suggested there may be a genetic component to the disorder, which is a brain chemical. ADHD is under complete control of the brain, but is usually motivated by emotions such as anxiety and fear. ADHD is usually treated by stimulants such as Ritalin, which is the most common type of treatment. Stimulants are the best way to treat the disorder. The only thing about stimulants is that the person can overuse or abuse the drug in the household. Behavioral therapy also shows some promises in treating a child with ADHD. The therapy increases the child's self-control and problem-solving abilities through modeling, role-playing, and self-instruction. The outcome of the treatments are usually successful, but not all children do outgrow ADHD. There's a lot of studies about ADHD. There's more children affected by this disorder than people think. The ADHD is not something a child can control having. ADHD will most likely be a lot more well known as time goes on.